Boom.
I turned off your 5 a.m. alarm.
Shut up.
Are we mic'd up?
Yes,
Is it rolling?
it's been rolling for the past
You
30 minutes.
didn't-
Okay, so
you
we're starting.
didn't- You didn't get that all that what I
I mean,
said.
but she can edit it out.
Hey guys, Dr. Fortes here, and we're starting my new podcast called Behind the Scalpel. First episode today. I'm very proud to have as my guest Travis.
Yes, I'm excited.
Good to see you,
The
Travis.
inaugural episode.
I know. Well, I wanted to ask you, tell me a little bit about yourself. I know that you're new to
Yep.
To
new the practice.
ACPS.
Yep. I've been here all of 3 weeks, which has been a great 3 weeks. So I am from Dallas. I moved here when I was 21. I've got some family here. I love Houston. I am an esthetician, licensed esthetician, as you know. I've been doing this for about 5 years, since 2019, and I love it. I mean, I love helping people. I love the perks are nice. all the
Oh,
treatments
yeah.
that we can do on ourselves.
Well, tell us
off the
about
skin.
tell us about how somebody goes into your field, becomes an esthetician.
So for me personally, I mean, I have always, well, first of all, I'm vain. So this is the perfect, field for me.
It's a great field for
Um,
that.
But second of all, when I was younger, I sort of struggled with my acne for quite a few years. So I was always in and out of dermatologist offices, trying to figure out lotions, potions,
Right.
medications. So about when I turned like 25, 26 is when I was like, you know what? I had a friend that is an esthetician. He actually recently passed away, but he was sort of like my mentor. So I got into the field. It's a year course, or it was for me. You have to pass 2 exams, written and practical, and then you're pushed out into the world of aesthetics.
Right. And I remember you're telling me that it came to you in a little bit of a lucky break because you were working in an office,
Yeah.
front desk,
Yeah.
and somebody couldn't continue in the role of esthetician, so you went
Yep. Went
right
straight to the
in.
back. Yeah, I started off at another plastic surgeon's office. Was at the front desk for a year. When I had gotten my aesthetics license, I was looking for a job for about probably 6, 7 months, and I eventually, because I knew I didn't want to work for a spa, because working under a doctor, you have more liberty with treatments.
Plus you have more backup.
Yeah, exactly. So I had applied for a front desk position, got that position, and then about a year later, after COVID, one of the other estheticians that was there, she just couldn't continue. So I moved my way to the back, and the rest is history.
So a lot of it is education, and it took you a year, and then you became licensed by
Yep.
passing a written exam and
practical.
then a practical. So it's not just walking in
Right.
and doing facials.
Right.
You have to earn your chops.
Yeah,
and,
exactly.
and get some experience before you start actually working
Yeah.
on clients.
Yeah.
And so you started working, doing aesthetics, and tell me what it is that you enjoy most about what you do.
So again, I really, I love being able to help people look and feel their best. Personally, I love doing more of the advanced treatments. I love lasers. Here at ACPS, some of my favorite treatments are BBL photofacial. Actually, I love all the Cyton modalities. So the BBL, the Moxie laser, the Halo laser. I love Morpheus 8. I've done a ton of those. I really, especially on myself, I've seen such improvement, with my skin.
Right.
So the Mirror Dry is also one of my favorite treatments.
Which we will talk about shortly.
Yes,
That's
this-
why the
this
machine's
baby.
here.
So yeah, I like doing facials, but again, I like some more of the advanced modalities.
Yeah.
And all the skincare that comes with all this.
So what's your skincare routine like now?
It's actually pretty minimal. I know that some people, love to do like a 10-step skincare routine, but I really don't think that that's
Right.
necessary. I mean, if you do, more power to you. For me personally, I really think the most important products are an antioxidant in the morning, which helps protect the skin from the sun, environmental stressors. That's something like your vitamin C, vitamin
Right.
E. And then during the day, of course, I use sunscreen. Everybody should use sunscreen. And then at night, I use a retinoid, and I'll occasionally do like a at-home peel pad or a clay mask, just because I have oily skin.
Right.
So the clay sort of pulls out dirt and oils. But I mean, it's pretty simple: antioxidant, sunscreen, retinoid.
So you can keep your skin looking good and healthy
Hmm.
on a regimen that's not too bad to do. You don't have
Right.
to do anything super complicated
Right.
at home.
Right.
Now, a lot of people ask, well, what's the difference between the products that I can get at like CVS or Walgreens versus the products that are offered
Yeah.
at the spa?
So, I mean, I tell patients no skincare is bad skincare. Obviously, there are better products like the ones that we have here.
Yeah.
While they're expensive, there's a lot of data and science that are backed into the products, and better ingredients, more efficacious. So I mean personally, I love these products. I've been using them for years. Some of my favorite
You're your own
brands.
patient.
Yeah, exactly. Some of my favorite brands are Skin Better. We've got Alastin I love. I tell patients not everybody has $1 million to spend on skincare, because I mean these products can get expensive.
Right.
So I tell patients, let's start with at least a retinoid. Alpha Ret is one of my favorites. It's because sometimes retinoids can cause irritation, like your tretinoin or Retin-A,
Right.
can cause redness, flakiness. The Alpha Ret by Skin Better is actually it's formulated with like peptides and other ingredients, so it doesn't cause that irritation. It's great for patients that have rosacea.
So there's a lot of research and development
Yeah.
behind these products that
Yeah.
probably aren't in the ones
In-
that you buy,
In the drugstore.
in the drugstore.
Yeah, and like I said, no skincare is bad skincare, but again, these do have a lot of research and development,
Yeah.
like you said.
And when patients come to see you, you have the expertise that you can educate them
Right.
on how best to use these products and take care of the skin and sort of fall into better skin care habits
Practices, yep.
at home.
Hmm.
And I know that doesn't happen when people just go on their own to
Right.
figure this stuff out.
Right.
And
Right.
most of the time they abandon the skincare and have all these products in their
Sitting there.
drawer
Yeah, and
of
I
their
think
bathroom.
most patients, everybody wants immediate results.
Yeah.
So if they try something and it's not working within 2 weeks, they're like, oh, I'm gonna use something else. And really, it takes like 12 weeks to see results from anything. And it's really important that I think it's really important that patients take pictures of themselves, because we look at ourselves every day in the mirror. We're not going to be able to pinpoint the
Right.
improvement. So you have to wait at least 3 months, and then if you feel like you don't see anything, or the results that you want, then we can switch it up. But it takes time for
Right.
these products to take effect.
Well, it's not just achieving a certain change, but also maintaining the health of the skin. So
Right.
it's like a maintenance program too.
Exactly.
And I know when I have patients that have surgery, one of the important things that I say to them is maintenance is key to maintain, your investment
Yep.
in the surgeries that you've had. So I know that one of the things that you do that you're an expert on is this bad boy behind us. It's called Mirror Dry.
Yep.
Tell us a little bit about Mirror Dry, what it is and
So
how it works.
this baby is used for excessive underarm sweat, which affects, quite a bit of people. It is a permanent solution to hyperhidrosis or excessive sweating. Device actually, so it's heating up the tissue to a certain temperature. I think it's like 140 degrees Fahrenheit, which is super hot. And it's destroying the sweat glands and some of the hair follicles with it. So it's a permanent solution to sweat reduction or over sweating,
And we live in a hot city, so you can
Yes,
imagine,
yeah.
everybody's out there sweating.
especially this time of year.
Yeah, exactly. And so it works by using microwaves, the
Microwave
same
energy.
microwaves that are in the oven in the kitchen,
Uh-huh.
and destroys the sweat glands.
Yep.
So how does it go? How does one prepare for it, and what do you do? You said that the machine gets pretty hot to
Yeah.
destroy the sweat glands.
Yeah.
So
So
there's
we-
some bit of numbing involved. How
Correct.
does
Yeah.
that
We
go?
obviously do not do it on unnumb skin. That would be terrible. So first we numb the so Mirror Dry is only used for the underarm area. Yeah, that's the only FDA approved area. So we numb the area topically first because a nurse will have to come in and inject lidocaine into the underarms. So that's pretty, I mean, the numbing injections is pretty much the most painful part, which is
Yeah.
good. So we numb that topically. The nurse comes in and injects lidocaine, and then 10 minutes later we can start the treatment. So you really don't feel much of anything. We do have to. There is a little bit of marking that goes with it. It looks like the template looks like a grid. We've got to make
Right.
sure that the area is the right fit. After we apply the grid, we start the treatment, and it takes about an hour. It's not super long. Yeah, we just sit there and enjoy the ride.
I had the treatment several years ago when the machine was brand new,
Oh yeah,
and I remember even the numbing wasn't too bad because,
Yeah.
you expect a little tiny poke,
right.
but literally once your armpits are numb,
Yeah,
you don't really feel
you don't
anything.
feel
The only
anything.
thing you really hear is the machine
Right.
doing the treatment,
Mm-hmm.
and that's pretty much it.
Yep.
So it's not anything that's super scary, and
Nope.
people think, oh my gosh, what is this experience going to be like? And
Right.
it's not bad,
Right.
not bad at all. Is this available for anybody, or are there certain people that probably should not have mirror dry?
You do have to be conscious about who you select. That's why it's important to come in and get a consultation before we do the actual treatment.
Yeah.
If you do experience, excessive underarm sweat, that is, what the device is indicated for. Also, it's indicated for odor as well. So if you, maybe are not bothered by sweat so much, but you experience a lot of odor, then it can help with that.
I've heard
It's
kind
not
of like
good.
the big three, sweating,
Yeah.
odor,
and hair.
and hair.
Yeah.
So
yeah.
you get
I know,
three,
and you wouldn't think,
three improvements.
you actually do get some hair reduction, which is awesome. So good patient selection. Obviously, no pregnancy, no breastfeeding. Typically have to be in good health. You can't be, on an oxygen monitor.
Right.
No pacemaker defibrillator because the microwave energy can affect that. But that's pretty, much the biggest contraindication. And also, if a patient does have what's called it's the hydronitis suppurativa, which is
It's like these chronic infections
right
of
the underarms.
the underarm glands.
Patient that has that unfortunately cannot get mirror dry. But that's really the biggest. No pacemaker defibrillator, and then no pregnancy, good health.
Yeah. I've heard people say, well, don't I need those sweat glands to be able to sweat in my armpit? Aren't those important? I mean, God put them in there
They
for
are
a
important.
reason.
Yes. We sweat because our body is regulating its temperature, but there's only it's like 2% of your sweat glands are in your underarms, so you're not going to be missing that 2% really. So it's really not an issue with I think some people are afraid that because you're removing these sweat glands that it's going to overcompensate somewhere else, which that's not really how it works.
Right.
So there's no really worry with that.
So you have the rest of the entire body to
Right.
sweat and cool itself. So
Right.
you don't really need that 2 to 3%
Right.
of the armpit sweat glands
Exactly.
to do that. So, and I know people can often be, especially the ones that have hyperhidrosis, which is kind of like sweating on steroids,
Right.
have difficulty with keeping their armpits
Yeah.
and hands and feet from sweating, and it's really a lifestyle challenge.
It is. It is.
But we're able to help them with the armpit sweat
Yep.
and the odor
Yep.
and a little bit of the hair too.
Yeah.
So once they have a treatment, what happens? Is it one and done? Is it immediate? Do they have to wait?
So
How does
results
it
are
work?
immediate. It does optimal results are after 2 treatments, done 90 days apart. But results are immediate. What the patient is going to experience after the treatment is some swelling, some redness in the area, maybe possible like nerve. It may affect the nerves a little bit to where you feel like tingling sensation. But those side effects don't last, but around a week. Everybody's different. It can last longer, but that's really it. It's not. You can typically go about your daily life after a treatment.
Right. Well, I remember when I had it done, I felt like I had carried these tiny pillows in my
Yeah,
armpits, and it was a little bit tingly, but I mean, it wasn't too bad.
Yeah.
And we recommend anti-inflammatories like Motrin, ibuprofen, Advil, those kinds of drugs.
Yeah,
I
and
didn't even-
definitely icing for
Yeah.
the day after treatment. You want to ice every 20 minutes for every hour. So
And you said probably 2 treatments are optimal.
Yeah.
90
90
days
days
apart.
apart. Yep.
So they can have a treatment, they have immediate improvement,
Mm-hmm.
and then they come back, see how they're doing,
Right.
and probably at the 3-month mark, do a second treatment.
Yep.
So how much reduction in sweat does 2 treatments achieve?
It's about an 82% reduction in sweat.
Okay, so it's
which is
pretty
quite a
high.
bit. Yeah, it's quite a bit.
Well, tell us about long-term results. Do people long-term
So
start sweating again, or?
nope. After this it's a permanent solution, which is awesome because there are other treatments out there that can help hyperhidrosis, but typically like I know neuromodulators like Botox and Dysport are able to stop sweating, but
Yeah.
after those are only they last for 3 to 4 months, and you have to go back and do another treatment, which it can become costly. You're doing that 3-4 times a year, and with this, you do it twice, and you're done. So I mean,
So
it's pretty
significant
amazing. Yeah.
improvement.
Yep.
Well, this is the machine back here,
Mm-hmm.
and you said it takes about an hour to
Yep.
do?
Yep, numbing for
Both.
about 30, 45 minutes, and
Okay.
then I mean, you'll probably be in the office for about an hour and a half. We have to consent and things like that.
Yeah.
But the treatment itself, it depends on the size of the patient and the size of the your arm area, but it's not long.
So this is a machine. It has a handpiece here,
So this
and
is the
I'll let you walk us through it. But
Demonstrate.
pretend like we're not on camera. Pretend like you have a patient here, and
so this is the tip, and this is where the suction is.
yeah,
And it goes around to the underarms, right here, and you just move it across
yeah.
across the
So the
board.
patients are on a
Yep.
bed
Yep.
with their arm kind of over their head,
Mhm.
so their armpit is exposed. It's already been numbed. Do they need to have any prepping solution or any
So
special
we
prep?
clean with HIPAA
Okay.
chlorhexidine, and alcohol just to make sure the area is really clean.
Yeah.
We do tell patients, and this is something that we email to all of our patients to make sure that they, follow these instructions, because if you don't, then we'll have to reschedule the treatment. So no shaving of you have to shave the area about 4 to 5 days prior,
Right.
because if you shave it any sooner, those little tiny micro tears can affect the treatment, and
They can show up
they
with
can-
little
yeah,
boils
and they
or
can
little
cause infection,
infections.
which we don't want. So no shaving 3 to 4 days, 4 to 5 days beforehand, and then no deodorant for about a day beforehand. But that's pretty much it. And then everybody goes home with post treatment care, so that because there's going to be some
Right.
side effects. So
So they have the treatment and they come back to see you to see how they're doing?
Yep.
Usually,
Do a follow-up.
when is that?
I mean, I definitely like to keep in touch with patients, for about a week, just to make sure that the swelling and everything is going, according to plan.
Yeah.
And then I think it's best to just set a follow-up appointment at the first appointment for 3 months to see if, they need another treatment. But I mean,
Right.
typically we like the patients to purchase in a package of 2, because, optimal results are seen after 2.
Mm-hmm.
They're going to see some after 1. So, that's that. But
And it's immediate, so they
yeah,
don't have
it's
to wait at
immediate.
all.
Right.
They literally can go home
Yeah.
with less sweating, especially if sweating is severe.
Right, and
for them.
we actually tell patients don't wear antiperspirant for about 2 weeks afterwards.
Yeah.
Which sounds, it sounds kind of crazy, especially for somebody that sweats excessively.
Right.
But with the treatment, again, it's killing the sweat glands immediately, so you really won't have that much sweating.
Exactly. And, we say that it affects sweating primarily and odor. But, a lot of the odor comes from that trapped sweat.
Right.
And it's not just
Bacteria
it's the
and-
bacteria with the sweat
Right.
that creates the odor.
Right.
So if you take care of the sweating, a lot of the odor
Goes away.
goes away.
Yep.
And so, yeah, you get, like I said, three improvements in one
I know,
treatment.
and I feel like the hair removal aspect is like a bonus.
Exactly.
Most people are like, I mean, that's a
Probably some of that is because the hair lives
Right, in that same area.
with the sweat gland.
Right.
And
Keep
that's
it in the
how
tissue.
you get treatment of all 3.
Mhm.
This is the machine. We talked about the handpiece. So the patient's asleep, or
Not
no, I
asleep,
should say,
yes,
not
yes.
asleep. And so you program the dry
Mhm.
to create the settings that you
Yeah,
need.
yeah.
Heat.
There's about 5 settings, and really the settings used depend on, again, the anatomy of the patient. So somebody who's a little bit thinner, you don't want to go too deep
Right.
with the settings, because if you did, it could cause some adverse events like striations in the underarm, which you don't want. So it's important to go to an experienced provider
Right.
in that sense.
So exactly, someone who's a pro, someone
Right.
who knows what they're doing,
Right.
how the equipment is programmed, because it's not just, one treatment for all.
Correct.
You have to be respectful of the anatomy
Yeah.
and provide a service that's effective and safe at the
Yeah,
same
and
time.
also be able to tell somebody if they're not a good candidate, then it's not a good idea for them to get the treatment.
Right.
Which nobody wants to hear that, but the reality is things can happen if you treat somebody that is not a good candidate.
Right. And I remember you mentioning that someone kind of forgot the preparation and had shaved a day
Yeah.
rather than several days before the treatment.
Yeah,
And
one
you
of my patients did that.
wisely said, we need to wait because you shaved within 24 hours and probably not a good time
Right.
to
Right.
have this treatment
Right.
under these conditions. What else is important to know about mirror dry, do you think?
So we went over who's a good candidate. Again, we have every patient post-care instructions, so they don't have to remember everything, because I know a lot is being thrown at them, in the consultation and in the treatment.
Plus, they're scared to death because
right.
it's something
It's
that they
new,
don't do every day.
Yeah, it's new.
But let me tell you, I've had it done, and it's not scary, I promise.
Yeah.
Even the numbing is not
it's
scary.
Easy. It's easy. I mean, I think we covered it. I think the biggest thing is it's permanent, which is awesome.
Yeah, that's fantastic. And plus, for people who are worried about exposing their bodies to aluminum salts
Yep,
and
and deodorant.
antiperspirant,
Yeah.
I mean, this offers a
me
solution that's
personally-
permanent.
Yeah, me personally, I mean, I love deodorant, but no, there are people out there that don't want to use aluminum, and maybe they don't have excessive sweating, but because they don't want to use aluminum, this is a good treatment because they won't necessarily have to wear deodorant afterwards.
Right.
With the reduction of
Exactly.
the sweat glands.
I've been very satisfied. I had the treatment several years ago. My sweating is minimal.
Yeah.
I would say probably I had a success of, 80,
Yeah.
80% or more.
Right.
And even on those days when I'm like out and about or maybe on a trip and I say, oh, I forgot to pack this, I can go a day or two and not have the embarrassment of, big sweat
Right.
stains in my armpit or smelling like I just ran a marathon or something awful like that. So, I mean, this is like a lifesaver, especially those people who have very severe cases of
Yeah,
hyperhidrosis. I mean, this is fantastic news for them.
My partner, for instance, really wants to get mirror dry done because he's
a sweater.
He's a sweater. We'll be like getting ready for whatever, and as soon as I'm out of the shower, he's already sweating. But this is another.
And he hasn't even stepped outside. Well, one important thing that you guys may want to know, that there's a promotion that's coming up or that's going on now, right?
Yeah, that's the most important part. Can't believe I forgot about it.
Well, one important bit for the audience that's tuning in, there's a promotion that's going on
Yes.
now.
Which is
Tell us about that.
the most important part. I can't believe I forgot. So it is 15% off 2 treatments with me only. The special is running through June 25th, starting June 25th, running through July 16th. Again, with me only. And ACPS, I don't have it on mine, but he's got it on his.
CPS.
Yes, Aesthetic Center for Plastic Surgery.
So they get you,
Yep.
and you're the mirror dry guru.
Yep.
So they're getting the best.
15% off for 2 treatments. I'm at the Kimberly location. That's where the device resides. So Kimberly location only.
Yeah.
So yeah, come on and get your
And get your
sweat
treatment.
reduction.
We're in the middle of summer in Houston.
Yeah.
And so what better time to treat the excessive sweating in your armpits than now?
Right.
Especially when we have a 15% promotion.
Yeah.
Sign up. It's great.
Yeah.
I can tell you from my own personal experience, it's fantastic treatment. I've loved it. Well, what other treatments do you offer besides the mirror dry?
So I love, like I said earlier, I love the BBL. Let me put this back. I love the BBL
Now,
photofacial device.
Now your BBL is different from
Yes,
what
it's different
they
from
think
your
about.
BBL.
Yeah, not Brazilian butt lift.
Right,
It's
I
a
don't- I
different
don't do that.
BBL.
So I love doing broadband light treatment, which is it's good for rosacea, pigmentation, sunspots. I love doing Morpheus. I've seen great results with improvement of textural.
And that's like a microneedling with radio frequency.
microneedling. Yeah. So there's again with that we numb everybody because I'm not gonna lie, there's a little bit of spice that goes with it. I've had several treatments, but I love it. I've seen great results. Moxie laser, halo laser. I love the the advanced modality treatments. And we offer all that at ACPS.
And the nice thing about that is that these are done in a spa setting,
Right.
local anesthesia only. You don't go to sleep, so
Right,
you
we've
don't
got
have to,
tons
it
of-
doesn't have to become more complicated than that.
Right.
The results are great.
Yep. Tons of
And-
experience here. So
Yeah. And you're coming to have a service in really a medically backed
right.
spa
Right.
that has, doctors within earshots.
Right.
I know that the spa is in the first floor of our building, and the doctors are either operating on the same floor or they're up on third floor seeing patients
Right.
in their clinics. So,
Which is great for,
we have several doctors all over.
in any event that there
Yeah.
is an adverse event, which nobody expects or wants it to happen, but it does happen.
But,
Very rarely.
if the rare event does happen, we can respond to it
Immediately.
and take care of patients.
Exactly.
Which is one of the most important things that we do.
Exactly.
So tell us about where we can find you.
So I am on social media. I do have an aesthetics page. It is aesthetic_agenda. Now it's currently loading. I don't have a ton of content on there because it's
Yeah.
new. That's AESTHETIC_agenda. But I have a personal Instagram that I will sometimes post some of my work-related things on there just because I have more followers. And that is Travy Wavy, TRAVY,
You can remember that,
Yeah.
right?
WAVY 21. So,
That's great.
Yeah.
And you are at the Kimberly
yep,
office
Kimberly office only.
at ACPS,
Mhm.
first floor,
Yep.
spa.
Yep.
So come see
Come and see me.
Travis.
Come and see me.
He's a pro. He
Yeah.
can do mirror dry or a number of other treatments
Get your skin looking right.
in our spa. Yeah. Develop a long-term relationship with him. Well, thank you guys, and I'm glad that today is our first podcast
I know, it was fun.
episode, and I enjoyed it, and I look forward to future podcast episodes.
Thank you for
Thanks
having
for
me.
being
Your first
on
guest.
the show with me.
Of course.